Hey guys, it's Manu, physical therapist and herbalist. So I'm going to show you a shoulder hand behind back movement stretch technique. And this is a good way to stretch the shoulder joint when you're trying to restore the hand behind back movement. And this could be after an injury, after rotator cuff surgery, various types of surgeries. Of course, you want to be careful in the initial stage of rotator cuff surgery. You're not going to want to get this far back. But eventually you need, this is a functional movement. In order for me to tuck my shirt in, reach for my wallet, I need to be able to do this hand behind back movement. So it's a compound movement, and there are three different movements that are taking place. You have shoulder extension, you have shoulder adduction, you have shoulder internal rotation that needs to be there at that joint. So I'm missing any of those ranges, it's going to make it difficult for me to bring that arm back here. Okay, so what tends to happen often is because of stiffness in the joint, could be soft tissue restrictions locally also, is that as the person tries to reach backwards, often the shoulder wants to drop forwards, and that tends to cause some pinching, some impingement, as well as it makes it difficult for you to accomplish that task because you're missing that range in that joint. The joint is stiff, and a good way to remind yourself to maintain that shoulder joint in a better position, or to do a little bit of self-mobilization while you're performing the movement, is to use the corner, right? So what I've found with patients is that when they, I'll show you guys on both sides. So if I'm trying to do a hand behind back on my right side, what I find is if I teach the patient to block the shoulder against the corner or edge of the wall here, right? It prevents them from getting into this habit of going forwards because they're missing that range of motion. Okay, so I'm gonna place my shoulder at the corner on this edge, and now all I do is just lean my body forward a little bit, right? So it's not too much force I'm applying, just enough to lock that position, right? So preventing the humeral head to drift forwards. Now I can work at reaching back, and I can use the other hand to assist that movement as I work at stretching into that hand behind back position. Now, from the other direction, what it look like is essentially, it's the same thing. Here's a corner, and I'm trying to prevent this movement from taking place, right? I want that joint in a better position as I work into getting these ranges. So I do a posterior glide, 8P, anterior posterior glide of that shoulder joint. Now you might have to play around with figuring out the exact angle, right, where it feels more comfortable to you, okay? But the general rule is just you want to make sure that it doesn't drift forward. So I lock it into place, and then I'm going to do that extension, right, and I do that adduction, and then do my internal rotation. So maybe initially you can only go to here. You use your other hand, you can use a towel to hold on in this position. You're going to grab this as I lean in, and I can work at doing some stretching, very gentle stretching in these positions. So I'm doing mobilization with movement. So I'm maintaining this glide. So the wall is making sure it keeps my shoulder joint going in that posterior direction to keep it locked in as I work at stretching, okay? Often this tends to be much more comfortable, even for doing just extension. If I want to work at scapular squeezes in the acute stage, and I'm not sure where the shoulder joint needs to be, and it continues to drift forward, this is a good reminder for the patient to keep that position as they're doing these backwards movements, okay? So works quite well. Don't crank on it too hard. Just stabilize it against that and gently work at reaching back, and use a towel if you need, a stick, or if you can reach with the other hand, grasp the other hand, and gently work at stretching that, okay? Keep in mind, if it's an acute injury, you just had a rotator cuff repair, you want to be very, very cautious. You might not want to do this one, okay? But for other conditions, when you're trying to restore that mobility, works very well, okay? If you have any questions, make sure you leave a comment, and check out the site, guys. Lots of cool information on it. Thanks.